stress of the holiday season just ahead, it's an important time to take good care of your health and to watch for signs that something might be wrong.
Today we have Dr. Michael McNamara with us. He's a cardiologist with West Michigan Heart and Spectrum Health Medical Group, and he has some very important tips for us to help us keep heart healthy. So let's start off by talking about coronary disease, because really there are some specific pieces of information we should all know about.
Sure. So the most important thing about coronary disease and what that is actually blockages in the heart arteries. So it's cholesterol buildup in the vessels, and that is the #1 killer in men and women in the country. So it is a very important problem, one that we deal with every day. And there are certain risk factors that will increase your chance of having heart disease.
Yeah. What are they? What are
so,
some we could be on the lookout for?
Yes, yeah. So the top 5 that I typically think about when I see a patient in clinic are a history of high blood pressure, high cholesterol, diabetics, those that smoke, and people that have a family history of early coronary disease. So they've had family members who've had either heart attacks or bypass surgeries at an early age, like in their 40s or 50s. So if you have those risk factors, and depending on how many you have, your chance of having heart disease is increased.
Okay, are there certain groups that are maybe more at risk? I know my dad had a triple bypass 5 years ago next week, and so I would think that maybe that puts me more at risk.
Yes, the early family history of heart disease always gets my attention. Members, usually you'll hear it in several family members. They'll say my uncle, my dad, my brother, people that have had heart problems. So those patients are most worrisome to me, that they are at the most risk. And diabetics are another group that are always at increased risk of vascular problems in the heart and outside of the heart. So those two categories get my attention.
I've heard a lot about people having problems, maybe even strokes coming on, and then not even really realizing it. As amazing as that really sounds, what happens to our bodies that maybe we could say, oh my goodness, this is something serious. Maybe I need to call somebody if I'm alone, or call for help? Sure,
it's a great point. We talk about, the term we use for that is a defective anginal warning system. So it's a fancy term that means your body does not interpret pain from the heart like what you traditionally think of as chest pressure, chest pain.
Yeah.
So that's common in diabetics and in women, actually. They have atypical symptoms, so instead of having chest pressure or chest tightness, they may have indigestion, or they may feel like they have the flu. They just feel a little bit off, and they don't have the typical symptoms. And so in patients who have 1 or 2 risk factors, generally we recommend don't blow that off. Call your physician. They can have you come in and do an EKG that same day, or they may tell you to go to the ER if your symptoms sound worrisome to them, but I wouldn't blow it off. We've seen that happen, and patients come in too late, and when they come in too late, they'll have more heart damage that we can't fix.
And it is interesting, because as women we know, and we hear it, that we are at risk because our symptoms can be so much different than we typically think of. It's not the, I'm grabbing my chest, having these intense pains. So is any of this preventable?
Yes, it is, and we have become very good at treating heart disease. The mortality has dropped significantly since the 1960s. The problem is that once you have disease, it's a lifelong disease. There is no cure, and so what we would prefer as physicians is to actually treat the patient in a way that we can prevent them from even getting the disease. And so a healthy lifestyle with exercise, good diet is important. Interestingly, this past Tuesday, there were new cholesterol guidelines released by the American Heart Association and the American College of Cardiology that we've been waiting for about 10 years. And in that this new set of guidelines, they're actually recommending more aggressive treatment of risk factors in order to try and prevent disease. So that's the goal, is let's try and treat risk factors and promote more aggressive medical treatment of patients at risk for heart disease, so that we can hopefully prevent them from developing disease downstream, instead of catching them after they get disease and trying to treat the problem once they've already had it.
Super proactive.
It is. There'll be a lot of discussion with patients, their primary care doctors, because the guidelines are estimating that the number of patients that would qualify for a statin medication, that's the type of medication that lowers cholesterol, now is probably 30% of the country.
Oh my goodness.
So that is a huge number, and it's double from the previous guidelines. And so there will be a lot of discussions with patients. Do I qualify? Should I have a statin? And it's it's an important decision to make, but one that should be done between the patient and their physician.
And you're offering an opportunity to have some discussion with people who might be interested in learning a little bit more about what you do, or perhaps they know they have a history of this in their family. It's next Thursday.
That's correct. We have a series called Doctor Dialogue, and it occurs next Thursday at Calvin College at 7 o'clock. There are going to be 3 physicians there, myself, one of my partners who's an advanced heart failure doctor, Dr. David Furman, and he deals with patients who have advanced heart failure and perhaps need or have already had a heart transplant. And then we also have a vascular surgeon there, Dr. Stefano Bordoli, and he'll be talking about vascular health, so vascular disease outside of the heart. And so it's a great opportunity for patients to come. It's free, and you can ask all the questions that you'd like, even those that you may not have thought of to ask your own physician. So
And sometimes it's good to hear what other people are thinking. You say,
Sure.
oh, I never thought of that.
Exactly.
Yeah, and especially with the new information and guidelines coming out just this week, super timely.
Yes, I'm revamping my
PowerPoint.
Yes, exactly. It changed all Tuesday night. So
Yeah, I'm guessing so.
We're very excited, and we hope everyone can come.
Yeah, wonderful. Thank you for coming in and
My
sharing
pleasure.
the
Thank you for having
information.
me. Yeah, you bet.
We'll be right back.